All right, hello everyone, and thank you so much for joining us. This is Georgie Carter from the Health Policy Plus project. I am delighted to welcome you to day one of our Family Planning Share Fair, our final set of end of project events for HP Plus. We have a great set of presentations lined up for you today, and we'll begin with just a couple of announcements. So this session is being recorded, and we will post the recording to the HP Plus website and YouTube page. We would love to hear from you, and we welcome your questions. Please submit your questions via the Q&A feature on the top right side of the meeting window, and our moderator will read them aloud during our Q&A session towards the end of the week. Now, these web conferencing platforms are getting a high amount of traffic, so we just ask that you bear with us in case there are any glitches with the technology. And finally, we ask that if you are not speaking, please mute yourself to keep the line nice and quiet while others are talking. That concludes our announcements, and I'll now turn it over to my colleague, Suneeta Sharma, Project Director for HP Plus. Suneeta?
Yes, thank you all for joining Health Policy Plus for our share fair. My name is Suneeta Sharma. I'm the Director of Health Policy Plus. I'm happy to welcome you today. Many of you joined us in March for our end of project event, where we highlighted our global policy, financing, advocacy, and governance work across many health areas. Today, I'm thrilled that this final knowledge sharing event is focused on our technical leadership in delivering family planning. Improving health outcomes for individuals, families, and their communities through family planning and reproductive health is the core of our work. We want to show you how the richness of HP Plus technical work strengthens the enabling environment. What had made this project truly unique has been our comprehensive and multifaceted approach. It draws upon policy and financing. It focuses on health systems strengthening, improved stewardship and governance, and equitable access to services. It fosters development and use of evidence-based innovative approaches and digital solutions that are adaptable to the local context. Our project comes to an end this month after a productive 7 years. During that time, we collaborated with more than 1,800 partners across 49 countries and achieved more than 2,000 results. This includes the mobilization of over $465 million in domestic health resources. We have supported 204 policies, including laws, regulations, strategies, and operational policies. We have helped facilitate the achievement of these results with a focus on localization and capacity strengthening. With the leadership of our local partners and our local HP Plus team members. Our staff hail from 50 different countries and speak 38 different languages. I'm so proud to have worked with this excellent cadre of professionals who dedicated so much, especially throughout the pandemic, to deliver these impressive results. As you see here, our family planning results by the numbers reflect their excellence and the strength and depth of their local partnerships. More than $58 billion has been mobilized as public sector allocations, especially for family planning. We are seeing impact through increased contraceptive use, including in these 4 countries, Burkina Faso, Ghana, Madagascar, and Tanzania. Just a few of the countries where HP Plus has supported costed implementation plans. HP Plus supported action on 88 family planning and reproductive health policies. To ensure sustainability, we have focused on financing for family planning. Over the last few years, HP Plus supported and advanced family planning and reproductive health financing at subnational, national, and global levels. We have supported stakeholders and decision makers and helped them develop capacity for budget advocacy, evidence generation, visualization, and communication to plan and understand options for family planning financing given their local context. We have strengthened the case for the integration of family planning into social health insurance and universal health coverage mechanisms. In 2018, we launched the Family Planning Financing Roadmap, which allows stakeholders to learn more about health financing concepts and how they relate to family planning. We have supported country program managers to develop FPRH investment cases and identify opportunities and effectively increase their domestic resources for family planning services and programs. We have explored the feasibility of innovative financing mechanisms to catalyze private capital and digital financing solutions to raise domestic resources. Global family planning advocates and practitioners are now better positioned to make a strong case to elevate and integrate family planning in primary health care and universal health coverage. Today and tomorrow, during our rapid fire sessions, we want to share not just what we have achieved under HP Plus, but how we achieved results. At the heart of HP Plus is our role in developing and sharing tools that can be adapted globally. We won't have the time to showcase all of them over the next 2 days, but we will highlight several of them for tomorrow. I hope you plan to dial in or visit our website when you can find them posted. I want to conclude by thanking our colleagues, USAID, who have been our tried and true partners over the past 7 years. I want to thank our colleagues at each mission whose creativity and ingenuity allowed us to create responsive and contextualized activities. I have so much gratitude for Veena Menon, our AOR, and Linda Cahalan before her, who have worked hand in hand with us and guided us throughout. Also in the Office of Population and Reproductive Health, I want to thank Bev Johnson for her tremendous support, both technical and inspirational, as we progressed, adapted, and implemented. Finally, I want to express my deep appreciation for Ellen Starbird for her outstanding global leadership. Ellen has been the family planning field's champion and guiding light. I'm so appreciative that she is with us here today. Welcome, Ellen. Over to you.
Thank you so much, Suneeta. That was really lovely. Thank you very much. And thank you so much to the project for all the work that you've done over the past 7 years. I'm really pleased to be here with everyone today and to have the chance to speak at this virtual learning event, share the highlights of the Health Policy Plus project's family planning and reproductive health efforts. As the world's largest family planning bilateral donor, USAID is committed to partnering and co-investing with local governments, civil society, and networks, and the private sector to help countries meet the family planning and reproductive health needs of women and men, youth, and families in all their diversity. Global projects like Health Policy Plus, USAID's flagship family planning and reproductive health project, are critical to the agency's efforts to increase access to family planning and other health services, no matter where you live or how much you earn. Today, in the 31 countries where USAID focuses its support, modern contraceptive prevalence has increased to 32%, very much in line with the 4 country examples that Suneeta had on an earlier slide. This progress represents a constellation of efforts, including by Health Policy Plus and its partners, who have collaborated on activities in 48 countries in Africa, Latin America, and Asia over the past 7 years. HP Plus and its predecessor projects have taken an integrated and comprehensive approach to family planning and reproductive health, including helping to develop and implement smart family planning policies alongside sustainable financing strategies, strengthen governance at the national and local levels, and equips citizens with data and the ability to generate it, package it, and share it to advocate for their health rights. Together, these elements have helped women and couples achieve and sustain their reproductive goals and helped communities achieve their social and economic growth. And HP Plus has done this throughout the life of the project. In Guatemala, advocates pushed for a new national policy overseen by subnational committees to guarantee Indigenous women access to family planning services and supplies in the Western Highlands and beyond. The HP Plus team worked with stakeholders to strengthen the formation of the National Contraceptive Security Commission and provided technical assistance to the Commission and the Ministry of Health to form local subcommittees. Those new subcommittees coordinate and monitor contraceptive supply and quality of family planning services in their communities. HP Plus helped establish the first 5 and developed a strategy map to replicate the subcommittees throughout the country. Since the formation of the subcommittees, Indigenous women's use of modern methods of contraception increased from 17% to 39%, and among non-Indigenous women, use increased from 43% to 58%. In Nigeria, a policy change in social health insurance reduced patient costs and improved primary health care centers, resulting in a drop in maternal mortality from 22% to 6% by the end of 2022. In Kenya, despite increased revenue due to COVID-19, the government increased the budget for family planning commodities by 38% from FY22 to 23, an impressive $11.3 million, informed by a thoughtful and evidence-based investment case for family planning developed by HP Plus. The project also strengthened the capacity of the family planning department teams to identify priorities and develop plans and budgets that are supported by evidence. As all of these examples demonstrate, local partners bring unique perspectives, skills, relationships, and a deep understanding of all the nuances of the local environment. And HP Plus country teams, all of them locally led, have been successful by leveraging their in-country networks and expert reputations to forge collaborations that will last beyond the length of the project. This ensures expertise remains in the country and that new approaches continue to be iterated and adapted in response to local needs. Our administrator, Samantha Power, has boldly laid out USAID's commitment to locally led development, in which local partners and communities lead agenda setting and project implementation. In many ways, HP Plus was an early adopter of this approach, strengthening the capacity of providers, local organizations, government departments, and family planning advocacy networks to assess the local context, lead change, and design sustainable solutions. And it's been doing this from its very first days. I also want to applaud HP Plus for offering creative solutions to operate effectively in the COVID environment, addressing country policy, financing, and governance needs to ensure continuity of family planning programs. The trusted partners of local HP Plus teams, like those working in Guatemala, Kenya, Malawi, and elsewhere, collaborated to ensure family planning remained an essential service and that people could access essential commodities. HP Plus also offered creative solutions to maintain operations, including embracing virtual engagement and creating digital tools for data collection and advocacy. We have a lot to learn and apply moving forward, especially as the communities where we work continue to manage COVID-19 and now monkeypox, as well as other shocks and stressors. And I'm sure we'll learn more about these creative solutions and adaptive approaches over the next 2 days of this end of project event. Digital solutions can support policy dissemination, amplify community voices, and link policy implementation across national, subnational, and local levels. Suneeta mentioned the Family Planning Financing Roadmap. By making that roadmap available as an online resource, key stakeholders learn more about health financing concepts, how they relate to family planning, and the options for financing family planning in their local context. HP Plus demonstrated that technology and digital solutions can add immense value to capacity strengthening, collaborative human relationships, and personal and political commitment. We'll hear about that in the presentations to come as well. Today's speakers will also share how stakeholder engagement can drive the development and execution of costed implementation plans. They'll explain how the project worked with finance ministries to mobilize millions of dollars for family planning commodities. And finally, we'll hear about rethinking accountability as governments, providers, and citizens working together toward common goals. What I hope you will take away from this event is that effective policy work requires taking a holistic view of the policy landscape. Every small success along the way energizes our commitment to helping local partners and communities see big results. I want to thank all of the consortium partners, some of whom we will hear from today and at tomorrow's event, who have played a role in each success, big and small, over the last 7 years. As USAID, other development and humanitarian partners, and our partner countries continue to respond to some of the greatest challenges of our time, your efforts to galvanize support for evidence-based family planning policies, sustainable finance strategies, and responsive tools are part of the legacy that will help countries meet the family planning needs of their people. Thank you so much.
Thank you, Ellen. Thanks for making time to join us today and for your thoughtful comments. Hi, everyone. I'm Jay Gribble. I'm Deputy Director for Family Planning and Reproductive Health of the Health Policy Plus project. Today, I'm happy to share some of HP Plus's successes and opportunities to continue to strengthen the policy environment for family planning. Following me, we'll have 3 closer looks at different aspects of our family planning work. And our session today will close with comments from Bev Johnston. There are lots of ways to think about what we've done. I think one of the most interesting ways is to focus on how HP Plus's work has contributed to the high-level outcomes that the Office of Population and Reproductive Health works to achieve. The first outcome is increased availability of high-quality family planning services. To HP Plus, this means how we advance the development and implementation of equitable policies that improve access to family planning, removing policy barriers, supporting new strategies, and developing tools that help expand services. The second outcome is increased demand for family planning information and services. To HP Plus, this means how we engage stakeholders to demand family planning services through holding decision makers accountable to follow up on policies and commitments. And the third outcome is increased domestic financial contributions for family planning. To HP Plus, this means how we help increase the funding envelope for family planning and guide stakeholders to mobilize new and sustainable resources for family planning. Over the years, we've learned a lot about how to approach policy work. We know that context matters, that cookie-cutter approaches don't work. We need to understand what matters to decision makers at all levels. A multi-sectoral focus is critical. Family planning is part of the health sector, but it's also linked to economic growth, to education, to ministries of planning and finance, to the private sector. We must improve equity and ensure stakeholder voices are heard and that all people have access to family planning. Youth must be engaged in a meaningful way and have a voice in the policy process so that programs reflect what they need and want. And we must approach family planning using a health systems approach. Family planning does not occur in isolation. It shapes and is shaped by all elements of the health system. In HP Plus, some of our best practices reflect how the enabling environment for family planning continues to evolve. Through a multi-level approach, we support transitions to subnational governments that are charged with implementing programs using national level guidance and policies. The links between advocacy and accountability reinforce that citizens are critical to advocacy for policy change, as well as for holding governments accountable for follow-through on commitments. Estimating, mobilizing, and tracking resources from CIPs to domestic resource mobilization to budget tracking, knowing what implementing a policy will cost, where the money comes from, and how it is spent facilitates progress and results. We strive to strengthen the capacity of individuals and organizations to continue the work after HP Plus is completed. That includes local partners, public servants, and our own country program staff. Finally, policy work requires and uses solid evidence and sound interpretation at every stage of the policy cycle. Let's start by talking about increased availability of quality family planning services. For each outcome, I'll share a couple of examples of our work, followed by introducing a few relevant tools and approaches we've developed, and a few thoughts on what remains to be done. HP Plus uses a variety of mechanisms to increase availability. In Madagascar, HP Plus was integral to the approval of a new rights-based reproductive health law. Our expert country staff worked behind the scenes at every step of the process in revising the law. We conducted advocacy training with family planning stakeholders. We presented evidence to Parliament during deliberations. And through everyone's effort, Madagascar now has a modernized approach to making family planning services available. Parental and spousal consent requirements are abolished. Health facilities can provide services to unmarried youth. Injectables can be provided at the community level. And operational policies are being updated so that more women now can obtain family planning. In Burkina Faso and Niger, we supported revisions to national reproductive health standards and supported the rollout of task sharing policies. And in Guatemala, HP Plus supported the development of guidelines to ensure the availability of family planning services during the COVID pandemic. Some relevant tools and approaches we've developed include an impact model to help countries project and estimate costs and benefits of introducing DMPA-SC through public and private service delivery points. Aaron and Michelle will be talking about that tomorrow. Our total market approach tool helps stakeholders understand in concrete terms what can be achieved through TMA and what might be realistic targets in the short and medium terms. Our subnational planning guide helps local decision makers better understand what the enabling environment for family planning is and what they can do to strengthen it. And of course, cost and implementation plans, which Laura and Modibo will present in our first closer look session shortly. But our work isn't complete. Equitable access to family planning remains an ongoing opportunity. We need to scale up self-care and ensure policies are in place and quality support is available. We need to harness digital solutions across all aspects of the family planning ecosystem, especially policy development and dissemination. And integrating family planning with MCH, HIV, and other kinds of services remains an opportunity at both the policy and service delivery levels. Decentralization is now a global trend. We need to ensure that family planning is included in subnational strategy and policy documents, and ensure that funds are allocated to increase the availability at subnational levels for family planning. And further codifying the roles of community health workers in task sharing policies will increase the number of qualified providers and improve availability of family planning. Efforts to increase demand align with our work on stewardship and accountability by strengthening how citizens, governments, and providers work together. To bolster civil society's role in planning and budgeting processes, HP Plus worked with neighborhood health committees in Zambia to better understand their rights to health. We trained citizens in social accountability and led 26 CSOs to participate in district family planning technical working groups. With greater citizen participation in planning and budgeting, we expect greater follow-through on government commitments. Malawi saw a decrease in the use of services by youth during the first year of COVID. HP Plus worked with a multi-sectoral group to develop guidelines for sustaining youth-friendly health services during the pandemic. The process helped to empower communities and youth to better understand their right to health services despite COVID-19 related barriers. Our tools and approaches include a legal and policy framework for accountability that helps organizations understand influence accountability relationships. Intergenerational mentoring brought together seasoned family planning advocates with young advocates to strengthen capacity and expand networks. Mentors and mentees alike found that the experiences were energizing and rewarding. The Gender and Governance Scorecard considers how well gender is integrated into the governance of family planning and MCH policies and institutions, and advancing gender principles within these program areas. We developed 3 new policy models, one that demonstrates the impact of family planning on the SDGs, building on work done by Ellen and colleagues at USAID early on. We have one on the benefits of family planning use by 15 to 19-year-olds, and one on population growth and deforestation. Scott will be presenting on the deforestation model tomorrow, and Lauren will be talking about youth count. And the joint accountability curriculum is a hallmark of what HP Plus has developed and been applied in several contexts. Ann and Allison will be talking about it in our second closer look session. Opportunities abound in this area. COVID has taught us how vulnerable family planning systems are. We need to continue to ensure that family planning is an essential service. Governments need to better engage citizens to identify solutions for meeting demand regardless of the circumstances. As countries continue to focus on sustainability and transition, they also need to better integrate family planning into health sector accountability and governance systems and increase demand for services. We see the need to continue to broaden stakeholder capacity, especially at the subnational level, so that the willingness to participate in accountability turns into real action. And of course, increasing domestic resources. HP Plus has worked with stakeholders to mobilize new and sustainable resources for family planning. We've worked at all levels of government and with the private sector to mobilize funds for family planning. In Burkina Faso, HP Plus facilitated capacity strengthening sessions with local and regional actors, including the WAHO Network of Champions, the Ouagadougou Partnership, and other stakeholders, with the objective of mobilizing additional resources for family planning. As a result of these efforts, the president of Burkina Faso practically tripled the budget line for contraceptives from 500 million CFA to 1.3 billion. In Malawi, HP Plus has worked with 5 districts to leverage project funds with their own operational funds to support family planning activities outlined in the CIP, activities largely related to youth services and community outreach and engagement. And at the local level, following an HP Plus regional advocacy workshop, the mayor of Dosso, Niger, mobilized almost $97,000 to update health centers, purchase contraceptives, and support women's income generating activities. Many of our health financing tools focus on resource mobilization. Our tool on improving technical efficiency addresses an underused way of making scarce family planning resources go further. Rebecca will talk about this tool tomorrow. The FP Financing Roadmap that both Suneeta and Ellen mentioned is an online tool that helps advocates understand family planning concepts and identify possible financing options. Together with the roadmap, the Family Planning Blueprints plays a complementary role in helping stakeholder groups understand what they can do to advance different family planning financing options. We develop guidance to help stakeholders leverage GFF funding for family planning and how to align the GFF investment case with the CIP. And our brief on sustainable and predictable financing for family planning provides stakeholders with a guide to the various tools and approaches developed by our health financing team to increase funding for family planning. Are there opportunities? You can only imagine. We need to better include family planning in different types of public and private insurance, as well as UHC initiatives. Public financial management and improvements in budget execution can ensure that allocated funds are spent on family planning and not reprogrammed. We'll hear about more on this type of approach from Dara and David in the third closer look presentation. In addition to private sector engagement, which Modibo will discuss, we can use blended financing to catalyze commercial sector funds to support different components of family planning programs. Today, I've shared only a few of our successes, our tools and approaches, and the opportunities to do more. This is just the tip of the iceberg. And now I'm pleased to introduce the first of our 3 closer look sessions. Laura Hurley and Modibo Maiga will share experiences in supporting CIP execution to help countries achieve their family planning goals. Laura, over to you.
Thanks, Jay. So as Jay said, we're going to be talking about HP Plus's contributions to family planning costed implementation plans, or CIPs, and some of our key successes, challenges, and lessons learned over the life of the project. HP Plus has worked closely with FP 2020, now FP 2030, to help countries meet their commitments to ensuring availability of family planning to their populations. Through both core and field support, HP Plus has supported the development of 21 CIPs in 16 countries and supported implementation and performance monitoring in 2 additional countries. We have mostly worked in Africa, but we've also worked in Pakistan, and we recently supported Guatemala's first CIP. Over the last 7 years, we've also worked with FP 2020 to develop more than 15 tools for the CIP resource kit. We have filled gaps in the toolkit to advance CIP costing, resource mobilization, stewardship, and performance monitoring. The big innovation that HP Plus brought to the CIP resource kit was the CIP execution process, which was based on Palladium's trademarked execution premium process. CIP execution is the process, tools, systems, and team that are put in place to ensure that the activities in the CIP are implemented and continually updated. The CIP map helps refine and prioritize results to be achieved. The priority results achievement chart defines indicators and annual targets to be used to monitor these results. The performance monitoring dashboard and monitoring approach are used to monitor progress. CIP execution ensures activities linked to priority results will be selected, since we all know that what gets measured gets done. So now I'd like to start with a sample of key successes rooted in CIP execution in 3 categories: policy successes, resource mobilization successes, and accomplishments using data for decision-making. First, HP Plus has supported key policy successes that were either integrated into the CIP or linked to the FP 2020 goals. In Burkina Faso, HP Plus supported the revision of the FP task sharing policy by working with the MOH to incorporate WHO policies for the delegation of DMPASC to private pharmacists and to users for self-injection. In Malawi, the goal of increasing the legal age of marriage was integrated into the first FP 2020 commitment. Following the commitment, Malawi passed the Marriage, Divorce, and Family Relations Act in 2015, increasing the legal minimum age of marriage to 18. HP Plus then supported the development of the National Strategy on Ending Child Marriage. In Madagascar, revising the reproductive health and family planning law was a priority result in the first CIP. As Jay mentioned, this law and its associated decree increased availability of family planning to all, regardless of age, marital status, or spousal consent. In Côte d'Ivoire, postpartum family planning services were scaled up to 40% of public sector health centers. This, combined with the task sharing policy and the new RH law, led to expanded access and availability. CIPs have helped mobilize resources at national and subnational levels and raised funds from the private sector. In Niger, following their FP 2020 commitment, the national government passed a 2019 budget allocation for 200 million CFA for the purchase of contraceptives. At the subnational level, Jay mentioned the example in Niger, and this was a strategy we used throughout West Africa. In Burkina, the mayor of Bobo Dioulasso mobilized funds from both the city budget and the International Association of Francophone Mayors for a total of approximately 75 million CFA. Modibo will talk more about the private sector engagement in CIPs in a few minutes. HE Plus has supported several accomplishments that came out of using CIP monitoring data for decision making. In Madagascar, the CIP financial gap analysis was updated annually. Following the results of the 2019 gap analysis, which showed a $67 million funding gap for the CIP, the FP committee advocated for tax exemption of contraceptives. With the multi-sectoral committee, the Family Health Directorate developed an advocacy kit, held advocacy prep meetings, and led the advocacy meeting with the Minister of Health, who then signed a letter to the Minister of Finance. Following this advocacy, the Parliament adopted the 2020 financial law integrating this tax exemption. This will help ensure engagement of private clinics, pharmacies, and drugstores, and support a total market approach to family planning services. So switching gears a bit, in this last year of the project, HP Plus conducted a review of the CIP approach to assess its value to countries' FP programs. We conducted an online survey for stakeholders in countries that had used at least part of the CIP approach. The survey was emailed to over 200 stakeholders in 40 countries. Survey responses were received from 47 people in 30 countries. We had good geographical distribution and a diversity of roles represented, including government staff, implementing partners, donors, civil society, and members of youth associations. Of the 30 countries represented by the respondents, half of them had been supported by HP Plus. In the first part of the survey, multiple choice questions gathered information on whether or not individual countries completed CIP steps and used CIP tools. This slide shows that the 2 steps in the planning phase were conducted by nearly all 30 countries. The steps in the development phase were conducted by the majority of countries, with a range of 77 to 90% of countries conducting each step. Phase 3 is where countries hit a roadblock, as is often the case with many policy and strategy endeavors. Momentum starts strong, but once a policy is launched, it can be hard to keep motivation up for implementation and monitoring. Only about half of countries reported providing effective stewardship, conducting performance monitoring, or developing and implementing a resource mobilization plan. While this isn't shown in the graph, we were happy to find that countries supported by HP Plus reported conducting steps 9 and 10 at higher rates than average. 67% for performance monitoring and 60% for resource mobilization. In the second part of the survey, Likert scale questions gathered feedback according to the 6 OECD criteria, which are listed here. Survey respondents were given statements and asked if they strongly disagreed, or neutral, agreed, strongly agreed, or didn't know. An average of 74% of respondents either agreed or strongly agreed to statements about relevance of the CIP to the family planning program and to family planning stakeholders. Key challenges were resource mobilization, performance monitoring, and the ability of the CIP to influence subnational stakeholders. Coherent statements received an average of 76% agreement. Key issues for coherence were alignment with budget priorities and alignment with non-health sector priorities, such as education. Efficiency and effectiveness scored the lowest at 60% and 62% agreement, respectively. The sticking points for both were statements around performance monitoring and resource mobilization. However, we were relieved to see that respondents from HP Plus supported countries responded more positively than average, with 70% and 71% agreement, respectively. For impact, respondents generally indicated that CIP moved family planning programs forward, improve family planning indicators, and help their populations access family planning. But resource mobilization was a limiting factor for impact. Finally, sustainability statements received 71% agreement, but respondents from HP Plus supported countries agreed at 79%. Key challenges for all country respondents were sustainability of resources, but for non-HP Plus countries, country ownership and capacity were also sticking points. Country ownership remains a challenge, but capacity building of stakeholders can address this. A whopping 83% of HP Plus country respondents agreed that FP stakeholders built capacity in health sector coordination and collaboration through the CIP process and agreed that stakeholders have taken ownership for CIP implementation. HP Plus's approach builds capacity and supports the CIP process without taking away ownership from the countries. Improved alignment of the CIP to government priorities and government and donor budgets increases coherence, efficiency, and sustainability of the CIP. Lack of inclusivity was the most common challenge raised in the qualitative survey responses. Additional inclusivity promotes relevance to all family planning stakeholders, and it supports resource allocation. Performance monitoring thrives with external partner support as both resources and capacity are needed. However, where CIP dashboards and final reviews were used, performance monitoring was deemed relevant, efficient, and effective. After the introduction of the dashboard in Togo, USAID West Africa asked HP Plus to roll it out to all countries in the region. Resource mobilization remains the greatest challenge across all 6 criteria. However, 67% of HP Plus country respondents agreed that stakeholders had built capacity and resource mobilization through the CIP process. We'll hear more about this from Modibo. So as promised, I would like to bring Modibo Maiga, HP Plus West Africa Regional Director, into the conversation. Hi, Modibo. Thanks for joining.
Thank you, Laura. Thank you for the great presentation.
Thanks. So my first question for you is about inclusivity in the CIPs. Can you tell us how West Africa has engaged youth in the CIP process and what have they been able to contribute?
Yeah, thank you for this very important question. First of all, I would like to say that CIPs are really implementing by governments. It's really the government which is in the driving seat. We want to ensure ownership from them. And what we are doing is really done under the great leadership of the Ministry of Health in all those countries. And I think we also spoke with them and they had a very strong commitment. This commitment was taken by all the ministries of health of the 9 Francophone countries, the OP countries, who have decided to dedicate more money to adolescents and youth. And as you know, given the significant proportion of youth in the region, it's very relevant to put them in the front and to ensure that their voice will be heard. And this is very important. This is a big change. What I can say, I would like to thank USAID, all the donors, the Ouagadougou Partnership, WAHO, Family Planning 2020, now 2030, all the donors. And Ellen mentioned it, this is really a constellation of effort. Things are moving in West Africa, even though it's slow. But what we are having is happening now in the area of family planning has never happened before. So the contraceptive prevalence rate is increasing, and Jay mentioned some cases like the Burkina Faso case. Youth, what did they bring to the table, as you mentioned? First of all, their energy, their commitment, their flexibility, and also the strength of the network. This is also something Ouagadougou Partnership did very well with the youth ambassadors and also Population Action International and Health Policy Plus capacity building, making their voice to be heard. And they have been in this process since the beginning to the end. All the steps, participating in the steering committees, in the technical committees, and also in the thematic groups dedicated to youth. In every single country, we have a thematic group dedicated to youth and adolescents with their leadership, and this is really making a big difference. You can see that due to their advocacy role and what they did, the budget has been increased everywhere. The think tank, I would like to thank them, the think tank, the youth think tank. At the beginning, the target was to have just 15% of the total budget dedicated to youth and adolescent in the CIPs. Now, in many places, I may say in all the Francophone countries, it's more than 20%. And in Burkina Faso, it's almost 30%. This is a big achievement. And they also advocated for family planning for free, for instance, in Cote d'Ivoire. And the Minister of Health took a decision to ensure that family planning will be also free of charge. So they participated very well in the process. We have now very sound champions, very good champions. They are vocal and they are very vibrant. Thank you, Laura.
Great. Thank you. Sounds very exciting. So thank you for that. So while most regions have managed to mobilize some additional domestic resources for family planning, only West Africa has mobilized private sector resources. How have countries been able to do this?
Excellent. I think the first thing we did is a mapping of the private sector. And mainly the private sector firms which are already working in the health area. And when we brought them together during a regional workshop we organized in Dakar, and they took several commitments, very strong commitments. But we realized that this is the first time they came across the CIPs. They came also across some concept like the demographic dividend. And what we did is also to show them the benefit from their own company. In many cases, the question was, what will be the benefit for us if we invest in family planning? So they want to know what is their own dividend on that. So we show the cases based on evidence. And I think this is something they really like. And they came with very strong commitment, more than 300K for family planning across 6 countries. And some of them have started implementing their commitment. And this is the case you mentioned, and also Jay mentioned, for Cote d'Ivoire, where we have a private company who gave money to a small organization, NGO, to implement family planning services. And in Togo also, a very strong leader, and Suneeta met with him during the end of project in Togo, also came with his own money to support family planning services. And we have many cases like this. Burkina Faso, we have a Babati group, which is a very strong group, who also came with money to support maternal health and also family planning services. So I think this is something we need to continue to do to increase their commitment to support family planning services. And we need to also have a room between them and the government to work together, closely together. And the government should continue what we have started, to continue to work with their own private sector. Knowing your own private sector is very important, and they have money, but what they ask, what they said is very often the government is not asking for money for family planning. And we need to make the case and show that they can do that. Thank you so much.
Thank you. That's a great example of public-private partnership. Thanks, Modibo, and thanks to all the participants. I'm now going to turn it over to Alison Lipsky and Ann Jorgensen to talk about joint accountability.
Thank you so much, Laura and Modibo. As Jay mentioned, we'll now transition to talk about HP Plus's approach to supporting a culture of joint accountability within health. So as we know, FP 2020, now FP 2030, galvanized incredible commitments for family planning at global level, and so much progress has been made since then. We also know that these global commitments still need to be translated into more action and more accountability at local levels. We also know that accountability for these commitments depends on effective relationships between various stakeholders, and these can ebb and flow over time as priorities come and go. In most contexts, accountability relationships are not well understood or acknowledged, and this contributes to weak accountability and muddles the ability to identify gaps in accountability for these commitments. To clarify gaps in accountability for family planning commitments and to strengthen the relationships and trust needed to institutionalize broad accountability, we and our partners developed a new approach. This approach increases knowledge of the accountability ecosystem for family planning and supports skills strengthening to understand accountability linkages and leads to consensus-driven recommendations for action. This graphic represents our joint accountability approach, which has 4 key steps. The first step is to support country-level learning through a 3-day workshop that includes multi-level, multi-sectoral stakeholders from government, providers, media, civil society, faith communities, whomever is crucial to strengthening accountability in any given context. The workshop begins with several definitional or terminology sessions, which opens up a lot of eyes about all that accountability encompasses. It's not just about the money. It's about sharing information. It's about creating opportunities for dialogue and discussion. And it's about defining and applying incentives and sanctions. The core part of this workshop is an accountability mapping exercise, whereby participants map various actors and discuss their roles and linkages across 3 types of accountability: political, financial, and programmatic, around a specific selected issue. After the mapping, the group selects the most important relationships from across this specific accountability ecosystem that really must function well to achieve the family planning commitments. The second step is to support the group to explore and assess further the quality and consistency of those selected relationships through a series of key informant interviews with selected pairs. The third step is when, after the group concludes their assessment, they convene a meeting with a wider group of stakeholders and decision makers to present their work, their findings, and their recommendations. At this meeting, this larger collective develops a consensus around an intervention or interventions to address the identified gaps. Finally, with the support from an HP Plus small grant, the local stakeholders implement their interventions. So as I mentioned, the core of the workshop itself is when participants create an accountability map. And this provides the foundation for catalyzing action after the workshop. Over the course of several hours, participants brainstorm key stakeholders around a particular commitment or priority. Then we facilitate a dialogue around the accountability relationship amongst and between them. We ask participants to think about whether the relationships are rooted in political accountability, in this case, where elected officials made policy promises around family planning, or relationships rooted in programmatic or performance accountability, such as for implementing a certain agenda that is based in policies, strategies, or guidelines? Or is the relationship also about financial accountability, which is probably what most people think of when they think about accountability? In each instance, at the end of this activity, as you can see, we see a messy, complex web of accountability relationships that may appear overwhelming at a glance, but actually, as you can see from the photos, because the participants were so engaged in creating it and debating each sticky and each link. They understand it, they own it, and they can explain it to others. After the workshops completed, we helped them make a clean map using what had been created at the workshop with yarns and stickies. This is an example from Kenya. And while this image is still complex, the group found it represents a new understanding of accountability in Kenya's devolved system, and it helped to show why it can be so hard to get things done and for accountability relationships and functions to be sustained. It also represents new learnings about weak and strong relationships and functions that either need to be strengthened or could be leveraged in new ways. At this point, I'll turn it over to my colleague, Allison, to share more about the findings and some of our lessons learned. Allison.
Thanks so much, Anne. And as she mentioned earlier, once participants have completed the map and all of these relationships are at the top of their minds, the group selects priority relationships for further exploration. These are relationships that are critical to achieving the goal or commitment under consideration, but also perhaps ones that aren't well understood or that may be weak. And there are two ways that participants can better understand these relationships. One is that they may do some qualitative data collection after the workshop, and this is how we initially designed it. The other is that they discuss the relationships at the workshop with the people in the room, and this is how we adapted the workshop as we continue to roll it out. Based on either the qualitative data collected after the workshop or on the discussions held at the workshop itself, participants develop ideas and recommendations for next steps and work to develop consensus on action plans. So on this slide and the next, I'll be showing some of the activities results, and I've grouped our results into two different categories. Some are about monitoring commitments and others are about catalyzing action. On this first slide around monitoring commitments, you'll note that interestingly, in our experience, most groups have chosen to monitor youth-related commitments in Benin, Guatemala, Malawi, Niger, Pakistan, and Senegal. While in Kenya, they focused on a challenge with decentralization around funding for family planning at county level. And in Uganda, they focused on challenges associated with producing timely and accurate data. One thing I'd like to point out about these results is that because of the multi-sectoral representation of participants at the workshop, often new groups of stakeholders were engaging in a monitoring mechanism in a way that they hadn't been before. For example, the media were included in the Uganda workshop, and this marked one of the few times that they had been involved in this kind of deep analysis of accountability issues for family planning. And in Niger, the youth participants had been previously sidelined, and with youth representatives at the workshop, they were able to influence the direction of where the workshop focused its attention. And while the workshops themselves were exciting, what we were really pleased about was the action that came afterwards. Across the board, we saw that the new relationships that were formed between individuals at the workshop endured, resulting in continued commitment to accountability for the selected issue. For example, from the first round of workshops in Uganda, the group worked together and leveraged the expertise of Track 20 to deliver a training to data collectors at district level. And in the following 2 years, saw a marked improvement in the accuracy of data collected. In Malawi, they established a national accountability task force to ensure continued collaboration to ensure the government continues to allocate funding for family planning. And one of our most recent workshops in Niger resulted in immediate improvements in communication and data sharing between the government and youth organizations to improve policy implementation. So we've now implemented this workshop in many ways, in many places, with many different people. And as a result, we now have 2 guides available on the HP Plus website. The original model, which sets the stage for doing follow-up participatory research that is led by the workshop participants. The later model has been adapted for use at community levels and is available in both English and French. There are a variety of other resources on the HP Plus website, including slide decks for specific modules of the original version and briefs about specific experiences from various countries. Some of the innovations that we see with this approach are that we've realized that due to the complexity of the accountability relationships and ecosystems, we're bringing multi-sectoral groups together that may not have had any meaningful connection before. Then, as Anne alluded to, the process of accountability mapping at the workshop itself builds relationships and trust. Participants develop respect for one another's expertise as they share their knowledge of their sphere of influence with the group. In addition, the approach has been shown to be widely applicable. It's been used to look at financing issues, data issues, youth access issues, adolescent pregnancy issues, and on. It really can be applied to any variety of challenges. Finally, its ultimate focus is on catalyzing locally led action to improve accountability, contributing to sustainability. So, what for family planning? Ultimately, what I'd like to leave you with is broadly, accountability is complex, and there are multiple ways of thinking about it. Comprehensively strengthening accountability is more than a scorecard or a checklist, though those do have important roles to play in improving accountability. Not only is the accountability ecosystem complex, but it will look different in every application. Stakeholders may overlap, but depending on the issue at hand, the strength of the relationships will vary. And because it's complicated, it is so easy to miss something. And there's a strong potential to underestimate the complexity of the accountability ecosystem. And this, in turn, can negatively affect how we do our work. This activity demonstrated the ability of collaborative spaces to foster dialogue and catalyze action among stakeholders at multiple levels, and we should seek additional opportunities to do just that. Each application of the approach brought people together from multiple sectors and levels, representing a microcosm of the health system, and together they built maps, they generated ideas and action plans together. This helped to ensure localized ownership of the results and targeted and contextualized review of where the system might be breaking down. Working together with the right people, the groups who are now using the joint accountability approach already are and will continue to make great strides. I think the strength of this approach is that they're creating the map, they're designing the interventions, and they are strengthening the relationships based on their own knowledge base and expertise. Then they build on the principles and approaches they learn at the workshop to identify new issues or new angles to addressing stubborn challenges, and they're ready to dive in. Thanks for your attention. And with that, I'd like to turn it over to my colleagues, Dara Carr and David Koya.
Thank you so much, Allison. It is a pleasure to present the results of our work in Kenya. I'll present a few overview slides, and then we're going to shift into a short interview with Dr. David Koya, who is the HP Plus Country Director for Kenya. Next slide, please. So HP Plus supported different actors from the Ministry of Health, especially the Department of Family Health, to make a really strong case to increase funding for family planning commodities. Additionally, HP Plus supported its partners to take a closer look at the extent to which existing resources allocated for family planning commodities were being spent and to address some challenges in this area. Overall, HP Plus helped the Ministry of Health promote increased funding for various health priorities, but of course today our focus is family planning. Next slide, please. So really important context for our efforts in Kenya was a policy commitment that the Ministry of Health had entered into in 2019 with various development partners. And this commitment took the form of a memorandum of understanding that basically laid out a plan for the ministry to assume full financing of family planning commodities by fiscal year 2025-26. So the MOU was framed in terms of funding ratios that the signatories had to meet. For example, in years 2 through 4, for every amount of money that the Ministry of Health put forward for commodities, donors agreed to match that on a one-to-one basis. So obviously, you know, this MOU is an important instrument, but we were not able to really find out if any entity was actually charged with monitoring adherence to it or reporting on it. But HP Plus certainly elevated it in its efforts, and it became sort of an anchor for some of our policy work in Kenya. Next slide, please. So HP Plus and its partners in government also thought it was important to translate these ratios into actual funding estimates to get a sense of the actual amounts involved. And as you can see from the orange bars, which represent the government contributions per the MOU, it's a substantial amount of scale up involved, where you have a government contribution, again, according to the MOU, of about $5.4 million in fiscal year 2019. And that needs to go over $20 million by fiscal year 2025, just about a quadrupling of funding required. And this figure is probably an underestimate because it's based on forecasting and quantification data that don't include important supply chain costs. Next slide, please. So HP Plus supported different actors in government to basically engage effectively in Kenya's budget cycle processes. And this is known as the medium-term expenditure framework. That said, most of HP Plus's technical support was focused in this first box at the top, prioritization and resource availability. And this is really the critical juncture for establishing the amount of funding that you're going to request and justifying it. This is when really critical meetings and presentations take place. The sector working group report is produced at this juncture. So very important time. But HP Plus also supported its government partners to capitalize on opportunities at other phases of the budget cycle to promote increased funding for family planning. Next slide, please. So we were really very pleased to see that there was a continuing upward trajectory in domestic funding from the government for family planning commodities over time, and that our partners in government had successfully promoted an increase of more than $3 million for the next fiscal year. And this is all the more remarkable, as Ellen mentioned earlier, because in the context of COVID, government revenues were hit really, really hard. So we were quite pleased. Some of you might notice in this FY22-23 bar that donor contributions look relatively low. And as we understand it, not all donor pledges had been received when we were looking at these data, and that this figure is really subject to change. Next slide, please. So now we're going to shift into an interview with Dr. David Koya, again, HP Plus Country Director in Kenya, to get a bit more nuance on what happened in Kenya. So how did HP Plus support government actors to advance the funding priorities in the budget process or the medium-term expenditure framework process? And how has our approach to capacity strengthening evolved over time?
Yeah, thank you, Dara, and good morning, everyone. Thank you for giving me an opportunity to share the Kenyan experience. HP Plus provided three major types of support to help government partners advance funding priorities during the MTF process. Specifically, the first approach was to provide facilitation or capacity building and supporting evidence generation, and not just generation plus usage, because we notice that sometimes evidence is generated, but the usage is lacking. Then the other approach we used was to foster consultative discussions between the Treasury and the MOH, because we realized that most of the funds are actually lying at the Treasury. And therefore, it requires that the MOH are able to actually advocate for funding from the Treasury. And our approach was to first bring together the technical staff of the Ministry of Health, as well as the leadership of the Ministry of Health, because often than not, the senior leadership of the Ministry of Health are the ones that engage the Treasury. And so we felt it was important for them to be brought to the same book so that they are able to advocate for more funding when they meet the Treasury counterparts. The other approach we used was to actually provide technical backstopping during sector meetings. As Dara has mentioned, the budgeting process is a back and forth process, and it requires that the responses that the Treasury require are actually able to come up immediately as they are required, because they inform decisions going forward. But in this particular MTEF process, as you have mentioned, asked, what we did differently is that we provided what we call classroom type of learning. And this was, to me, a refresher of some sort, because the same teams, we had taken them through some training earlier in the year. But just before the MTEF process, we decided to have sort of a refresher, especially for those technical staff that were going to be involved in the MTEF process. The other thing we did was to accompany the partners or the government throughout the retreat meetings that they had during the resource discussions, because we realized that they needed a lot of support. And during that those retreats, we actually set up a secretariat center, which we used actually to support the teams to provide sort of real-time responses whenever they were required. And this was very critical, as you will realize when we report on the results, because there are certain questions that keep recurring every year, given our experience as we have supported the MTEF process. There are certain questions that even without attending, I can always say this question will definitely be asked. And so we set up a mock center sort of where we were supporting and sort of preparing the MOH staff to be able to respond to those questions that we were very, very sure they were coming. But more importantly, we also facilitated what we are calling support timely responses, giving backstopping, technical backstopping to the teams during the resource sharing discussions, because some of these responses, they arise as a result of questions that are asked during the meetings when the resource sharing discussions are happening. And that actually marked the difference between what we have been doing before and what we were doing this time around. We were very targeted and intentional in ensuring that we address each and every issue that we have observed over the years that we have supported this process. Over to you.
Excellent, thank you. Thank you, David. Next slide, please. So we know that there were many barriers in promoting increased funding. Could you speak to one major barrier that the team faced in the recent year?
Yeah, you are right. Actually, there are many barriers, but because you've asked for one major barrier, there's a barrier that keeps recurring, and this is the barrier of budget execution. Every time we go for MTEF discussions, the most important issue that we have to deal with is the issue of low budget execution. And this impacts very negatively on efforts to advance or to advocate for more funding, because many a times the question is asked, we gave you so much last year, you were not even able to spend even 60%. How come now? Why do you think now you need more? And for the past year or so, actually last year, the year before the MTEF process that we were supporting, the department had only spent 65% of the budget they had been allocated. And so it became very difficult when now they are faced with questions as to why do you require more? And the reason why this become a critical issue is because you need to understand why the budget execution was low. And so we came in very handy to try and do some analysis in the background to try and understand why the budget execution was low. And because the responses you give are very critical, some of the people who are asking may not even be aware of those barriers until you explain and you show them how they will impact you in the coming year. That's when they will now realize the importance of allocating more funds, even when the budget execution was lower in the previous year.
Excellent, thank you, David. Next slide, please. Okay, donors have supported years of capacity strengthening interventions with government. Could you speak to how we tried to ensure these capacities are sustained beyond the life of the project?
Yeah, thank you. One of the things that has actually been discussed even with the mission locally here is that we have been providing capacity strengthening year in, year out. How different is it going to be going forward? And it's out of those type of questions that we decided to now focus and try to come up with new strategies to deal with this. And remember, this is only coming out because of the experience we've had. If we were new in the field, of course, we will go and say, let's go and strengthen capacity. But capacity alone is not enough. We need to come up with governance structures that will ensure that the capacity strength that has been strengthened is retained. And one way in which we were doing this is to actually build the capacity of the planning division, because we realize that the planning division of the Ministry of Health is actually a team of people who are seconded from Treasury, and they are supposed to provide planning and budgeting support to the Department of Health. But because of lack of funding and lack of sometimes being intentional to support those functions, that function has not been performed. And that's why in the previous year, we tried to work with the planning division, trying to make them lead the process so that going forward, they will now be able to lead the process year in, year out. Because normally when the budget is released, it's supposed to be led by a team of planners at the planning unit to actually support the planning, the different departments or sections of the Department of Health to plan and budget. The other thing which we did was to recommend a new planning process where we have somebody dedicated, for example, to oversee the issues around the flow of funds, especially flow of funds for commodities, because these funds are normally hosted at Treasury. They are never transferred to the Department of Health, and there's a need for initiation of the procurement process so that the funds could now be channeled, released from Treasury to the procuring agency, which is KEMSA. So having a dedicated person was one of our recommendations to ensure that these funds are actually initiated, their flow from Treasury to KEMSA, because it's only that the execution will be. Then the other thing we try to do is to try and see whether we can get the technical working group, which is tasked with overseeing the activities and priorities of the department, to have the budget execution as one of their agenda items during their discussions. Through this, of course, they will now be getting feedback from KEMSA, they will get feedback from Treasury, so that they are able to now deal with the issues of budget execution head on, because it's one of their agenda items. Over to you. But we, of course, we had other approaches which we were very specific to the county sub-national level, but because today the focus is a national level, maybe I'll just mention that we've been supporting the county health planning units to be the engine of planning at the county level, because as many of you will realize when you look at the data from the Kenya, you will see that health sector actually accounts for about 30% of the funds that go to that are utilized within each of the counties. And so having a planning unit within the Department of Health will be a big success to ensure that funds are actually executed in the best way possible. Over to you.
Thank you, David. Excellent. Next slide, please. So just a huge thanks to USAID and to our Kenyan government colleagues and to the HP Plus team in Kenya. It was a wonderful collaboration. And now I'm going to turn it over to Jay Gribble for the next phase. Thank you.
Thanks, everybody. Great presentations. It's always fun to hear about the great work that we've undertaken and the successes that we've achieved. If the speakers could turn on their cameras for a few minutes of discussion, I think the one question that came in was about the joint accountability curriculum being available in other languages. So Allison, do you want to jump in on that, please?
Happy to. So right now, the main curriculum is available on the website. For the curriculum that's designed specifically for community and faith leaders. That one is available both in English and French. And that is lots of similarities between the two curriculums. So hopefully if you need it in French, you can start there and make the adaptations to a different version if that's needed. Unfortunately, we don't have any other languages now, as we have only applied it in either Anglophone or Francophone countries, but we certainly hope to have the opportunity to use it in other places.
And if
Thanks,
I might
Allison.
add,
Sure.
might add, Jay, real quick, please also note on the website, everything is available in Word as well as the PDF. So that should make it easier for translating and for adapting in any which way you may want to adapt it for your use.
Perfect. Thanks, both of you. We have 5 minutes, and so I'm going to just lob out an easy question to you. We can't talk about HP Plus, particularly the past 2 or 3 years, without thinking about COVID, because it has just been the context in which everything has happened. So if you could just quickly share some of the ways that the work you've been involved with, how we have overcome the challenges that COVID has presented, because it may be COVID, next time it may be something else, it could be another pandemic, but there are other types of shocks to systems where people live and we try to do our work. So just, briefly, any thoughts about how we can advance in spite of these types of shocks? We've got 4 minutes.
So we were warned that we were facing an uphill battle to promote increased domestic funding for family planning commodities in this context of COVID. I think perhaps taking just this very responsive sort of mentoring approach where we accompanied our partners through these processes, which was a real change from the years before. And during these budget processes, you get asked a question and you have to have the answers either immediately or by 9 o'clock the next morning. So I think accompanying the partners and just intensifying our efforts around this, I think made it a difference. Although David could probably speak to this more.
Yeah, so you are right, Dara, because there are 2 things which we did, which I think, despite the COVID, we were able to achieve some results. One is to, like I said, to support the department to justify why they are looking for funding, especially increased funding. And this we did through supporting them to come up with justification memos, especially to support some of their asks. And like you've said, also being available to be able to provide those responses real time, as it were. And having a mock sort of a presentation where we subjected the Department of Health staff to a mock presentation in the panel, so that because we have done this before, we tend to know some of the questions that are asked. So I was made, for example, the chair of that mock session where I was asking those difficult questions that will be asked during the panel discussions. So one of the questions I was asking is, you are looking for more funds, but you didn't spend money last year. So why do you need more money? So, to prepare them in advance so that by the time they go for the discussions, they now have evidence and the responses adequate, appropriate for the type of questions that are asked. Over.
Thanks, David. Allison or Anne, any thoughts on COVID, other shocks, what we've done to overcome them?
I think for us, I think the relationships that were developed at the workshops themselves really ended up being the foundation for continuing the work. And then, frankly, don't underestimate the value of low-cost, widely accessible technology, right? So, for example, the Malawi task force that ended up being established got its start on WhatsApp. So they came together for the workshop. They decided they wanted to have a WhatsApp group. And then all of a sudden, months later, they're calling themselves this task force, and they're talking about developing a terms of reference. So I think it was the combination of these really strong relationships that they had developed, plus a widely accessible technology that they were all already using, really helped to move things along.
And I might add, it really amplified the strength in HP Plus's longstanding model of working with and through local teams to work with and through local partners. I think it's humbling to see actually, and it's very good for all of us sitting here in Washington to realize that we really have to look hard at our role and where could we be specifically most helpful and where could we get out of the way and help local leaders lead in the way they know best. And I just really want to shout out to all of our local HP Plus country teams who really make all of this happen. So
Thank you.
Thanks.
Laura Modibo, any quick comments on how COVID didn't stand in the way of CIP work?
I have sort of a positive side of COVID was I feel like with the decrease in family planning use that happened at the very beginning of COVID, people were able to take that to advocate for self-injection of DMPA-SC approval. So a lot of policy advocacy and policies got passed quickly because they knew they needed to keep women engaged in family planning without having to expose themselves to COVID at health centers.
Modibo, a brief thought.
Yeah, thank you, Anne, for your comment. I really like it. So I want just to give you an example. I recently came from Niger, and what we are doing is to work with champions, advocacy champions, to continue to advocate for more money for family planning. As you mentioned in your presentation, and also Laura did it, Niger, they increased the budget from 22 million to 200 million. And they told me Modibo now is 250 million. And our target is to go for 800 million in the coming months. So I think the advocacy effort help us to keep the money for family planning. I don't see any country in the region who decrease the money for family planning commodities due to the champions and the advocacy network we have in the region. Thank you so much.
Great insights. Thank you, everybody. Just so everybody knows, this is just a few of our staff members who have been involved in HP Plus. Certainly our work has been carried out by dozens, if not, 20 scores of staff in the US, and certainly hundreds through our country programs. So I want to thank all of them for their 7 years of successful work. I'd also like to say thank you to Palladium because we've served as prime for this, but we couldn't have done this certainly without our partners, RTI International, PRB, Plan International USA, Avenir Health, the White Ribbon Alliance, and ThinkWell. Together, we have, I think, had a tremendous project and made a lot of difference in advancing family planning. Now I'm going to turn it over to Bev Johnston for closing comments. Bev is Division Chief in the Office of Population and Reproductive Health for Policy Evaluation and Communication. Bev, thanks so much.
Thank you, Jay. And I want to say what a set of impressive activities and results that we've heard about today. I want to thank everyone for joining us today, especially our speakers. I've personally learned a lot from these presentations. And as we close out today's event, I'd like to share just a few of the takeaway messages that I've picked up. So first, Jay's remarks confirm my thinking about the importance of a policy, advocacy, financing, and governance project like HP Plus. As Jay noted, the HP Plus's efforts contributed to improvements in family planning, service delivery, demand, and access. And the project also contributed to greater financial resources, so supply, demand, and financing. My second takeaway is that the more an activity integrates policy, advocacy, finance, and governance, the more it can advance the enabling environment for family planning. So the integration of that policy, advocacy, finance, and governance approaches increases the sustainability and that lasting effects of an activity itself. And we saw 3 diverse examples of that this afternoon. In the presentation on costed implementation plans, we saw that country ownership and sustained impact are more likely when stakeholders continue to coordinate efforts to achieve common goals and advocate collectively for greater domestic financial resources. So Laura and Modibo described and discussed a systematic country-led approach to translate those cost and implementation plan goals and objectives into action, resulting in well-identified programmatic efforts that achieve measurable results with governments in the lead. To just repeat what Modibo had said. Anne and Allison, your presentation on joint accountability demonstrated that when government decision makers, citizens, and healthcare providers work together, they can reach consensus on how to achieve goals and meet their commitments. So it's that joint accountability, while complex, can advance policy implementation, as well as financial and other commitments, because it focuses on reaching common goals through dialogue and collaboration. And in Dara and David's presentation on resource mobilization, we saw the importance of engaging policymakers with relevant information to guide their decisions. So government champions understood the budget cycle and the public financial management systems. And then they were able to generate the necessary analysis on what was needed and communicate that persuasively to the right people to make key budget processing decisions. So each of these examples reinforced my third takeaway, that policy work is context specific and is most successful when it is locally led. So supporting local leadership, systems, and capacity, and embracing more inclusive development partnerships are among USAID's policy framework. So local stakeholders understand the issues and know the policy actors. They have the credibility and the capacity to navigate systems that link national and subnational policy opportunities. And local stakeholders will sustain the momentum of policy activities and hold decision makers accountable long after acute policy work is complete. So finally, we must not underestimate the role of community involvement. The interaction between decision makers and citizens fosters buy-in, strengthens accountability, it builds consensus, and it collectively aids sustainability. So I am so happy to have had a chance to participate in today's event and share a few of these reflections. So congratulations again to HP+, all of the teams in Washington, all of the teams around the world for achieving results in so many different areas. I am so thankful and so grateful for all of your work over the last 7 years. So what we've discussed here today is only a small part of HP+'s successes. And what really matters is that HP+'s country staff and local partners are equipped to carry this work forward and really making localization a reality. So on behalf of USAID and HP+, thank you all for making time this afternoon and this morning. And we wish you a very happy rest of the day and rest of the evening. So thanks everybody and goodbye. Thanks HP+.
Thanks, Bev.
Thank you. Wow. Good job.